Hi everyone, this is Kathleen Warshawsky. You're at SBB University Caregiving Resources. Today, our guest is Miss Emilia Bourland with AIPC Therapy. She's going to talk to us about fall prevention, the big picture, part 4. Stay tuned.
Hello everyone, I'm back again for Fall Prevention, the Big Picture Part 4. This is the final session in our four-part series all about fall prevention, comprehensive solutions, really looking at the big picture. And what we're going to talk about today is the person. What does the person have to do with the fall? What are the physical, sensory, and cognitive characteristics that impact someone's fall risk? What can change, what can't change, and what we can do about it. So if this is the first part of the series that you are watching, let me briefly introduce myself. My name is Emilia Bourland. I'm an occupational therapist. I also have my executive certificate in home modification from USC's Leonard Davis School of Gerontology. I am an educator, or I was a former educator at Texas Women's University, where I taught in the Master of Occupational Therapy program. And there I taught both hands-on clinical skills and advanced clinical reasoning. I'm a published author and expert in fall prevention, and I'm the owner of AIPC Therapy, which is a mobile occupational therapy practice. We're absolutely dedicated to helping seniors live as independently as possible, as safely as possible, with the highest possible quality of life. So if you're here with me today, it's probably because you have either experienced a fall personally with a patient, a client, or a loved one. It's because maybe you're worried about safety. Perhaps you're confused or you're unsure about what works and what doesn't work in fall prevention. Maybe you've been let down by past fall prevention programs or education. Perhaps you have concerns about liability due to client or patient falls. You need evidence-based solutions. And most importantly, you're here because you care about doing what's best for you, for your loved ones, and your clients and your patients. This series on fall prevention, the big picture, is best for families, individuals, and professionals who value safety, families, individuals, and professionals who want to foster independence, families, individuals, and professionals who want comprehensive solutions, and families, individuals, and professionals who want high impact strategies. Before we go any further today, this is a general fall prevention training program. It is not a substitute for individualized intervention for fall prevention or medical conditions. So if you are working with someone who needs individualized training or solutions for fall prevention, if someone needs intervention for falls or a medical or health condition, then please reach out to a licensed healthcare provider such as myself or another professional in order to get the help that you need. So we'll start again by just defining what is a fall. And if you haven't watched the other parts of the series, we'll go ahead and do it. If you have, we'll kind of move briefly through this here. But so a fall is any kind of uncontrolled descent to any surface or any attempted movement that ends up on the floor when the floor was not the goal surface, okay? And it's important to really define it broadly like that, because often in healthcare, we only define falls as when someone hits the floor. However, there's this great number of falls that goes uncaptured because the person maybe is falling onto a bed or into a chair and they don't hit the floor. But those are opportunities that we need to see where we can step in early and prevent future falls so that that person doesn't end up having a fall where they go to the floor and they're seriously injured. So that's why that's important to do. Some myths about falls that we've been carrying through the series that I want to always keep in your mind. First, it's a myth that falls are just part of getting old and are inherently related to age. It is absolutely a myth that we should all expect that as we age, we're going to start falling, and that's a natural part of the aging process. It's absolutely not. Another myth about falls is that it's okay to fall as long as the person hasn't been getting hurt. It's really truly only a matter of time before that that injury occurs. So we want to step in early and prevent that from happening. The other myth I want to highlight is that the best thing to do to prevent falls is to immobilize the person. 99% of the time, that is actually going to increase the number of falls that the person is having, and it's going to more likely lead to a serious injury when they do fall. So this is our long list of why falls happen, and the ones that we're going to address here today are highlighted in green. So we're going to be talking about changes in the person, muscular balance, cognitive, new and progressing medical conditions, and sensory changes or loss, and how those impact falls. So how do those personal characteristics affect falls? I'm going to start off with a story, as I usually do. So this is, but this isn't, this is going to be, it's not going to be the typical story for me. So this is a woman in her 70s that I treated many, many years ago before I had a private practice. She had dementia and a balance impairment. She lived at home with a mix of both family and paid caregivers. And she had started to fall, and the falls were related to both cognitive issues that she was having from the dementia, as well as some balance deficits that she had. Ultimately, she had a fall that led to a hip fracture and eventual placement in long-term care. And she unfortunately passed away not too long after that. And I know that generally the stories that I tell have happy endings, and I wish that they would all be that way. But the fact is that this is all too often the unnecessary and unintended consequences of falls when we don't step in and take action to prevent them from happening. It's stories like this because unfortunately, this isn't, this isn't an isolated event or an isolated experience that I had interacting with people who had had falls, working through traditional healthcare models. And it's seeing things like this happen over and over and over again that I knew could have been prevented with the right action, with the right proactive intervention, that really pushed me to go out and start working in this way to stop things like this from happening to folks like this dear woman who fell and ended up not having the best outcome. But so let's talk a little bit about what the essential ingredients are in fall prevention. Again, I'm going to kind of take it back to the very first series and sort of remind us as we wrap up this process what they all are. So the first part of the series was about understanding risk and understanding the awareness of possible consequences so that we can increase our desire to act. The second part of the series was all about the environment, friend and foe, and how changes in the environment can either increase or decrease someone's fall risk almost instantly. The third part of the series was all about activities and about how we do what we do matters when it comes to falls and fall prevention. And then the fourth part of the series, we're going to wrap it up here today now, is all about the person. What are the physical, sensory, and cognitive characteristics that impact fall risk? What can change, and what to do about it? So if you haven't watched those other parts of the series, please go back after this and make sure you watch them. They are all parts of the essential ingredients in the recipe for big picture comprehensive fall prevention. So the goals of fall prevention, part 4, the big picture. By the end of this session, I want you to understand at least 3 aspects of a person's physical, cognitive, or sensory characteristics that affect fall risk that you may have been previously unaware of. I want you to understand at least 3 fall risk factors that can often be rehabilitated by directly treating the person. And I want you to identify at least 3 fall risk factors that require more than just treatment of the person. I also want you to have greater confidence in seeing how the connections between personal characteristics, activities, and the environment work together, how they interact to influence our fall risk, either making it higher or lower. So what are those personal, physical, sensory, and cognitive characteristics that impact falls? So the physical and sensory characteristics of balance and falls. Vestibular. So your vestibular sense it's part of your inner ear, and that's the sense that tells you your body where your head is in space. It tells you what direction you're moving, how quickly you're moving in that direction, and kind of your overall position in space. It's very, very important in balance and falls. Proprioception. Proprioception, so you have these nifty little sensory receptors in all of your joints that tell you where your body is in space and what position it is. So if you all would like, so if you close your eyes and you hold up your hand, your proprioception is the sense that's telling you right now that your hand is raised. Believe it or not, people can actually lose that sense and really not feel where their body is or what position it is in. Vision, of course, plays an important role in falls and fall risk. And of course, we think of it traditionally as if you can see what is in front of you, if you can see obstacles, then that helps you to prevent falls, which is of course true. But there's also part of your vision that's really deeply tied to that vestibular system. And when your vision and your inner ear, that vestibular system, don't match up, it can create a lot of difficulties with balance and falls. Sensation, particularly the sensation in your feet. In order to avoid falling, it's really it's best if we can feel the floor. And when we don't have good sensation on our feet, it makes it much more likely that someone will fall. Muscular strength, of course, is important, a physical factor when it comes to falls and fall risk. Motor coordination, so how well all of your body works together to achieve a particular movement or a particular functional task. And range of motion, so how far your joints move can absolutely affect your overall fall risk and balance. So what are the cognitive characteristics that impact falls? Attention is one of them. Distraction, orientation, visual attention, visual scanning. So for example, a lot of times when folks have dementia, they will start to really see kind of only a very small visual field, and they won't look outside of it. So it's much harder for them to see obstacles in the environment or to take advantage of safety items that might be there for their use because they're not looking for them. Automatic movement patterns and activity performance. So if someone's been doing something the same way over and over and over again for many years, they're likely to continue doing it that way. And if it's not a safe habit, then that can increase someone's fall risk. If someone has a cognitive issue, then a lot of times their automatic movement patterns will be kind of what they default to, and so it can be tough to change those if those are risky movement patterns or habits. Just to clarify a little bit more. Memory, short-term and working memory affects someone's fall risk. Their ability to retain new learning or to acquire new learning can be a cognitive characteristic that impacts falls. And a poor ability, if someone is cognitively unable to adapt to a new environment or unfamiliar circumstance, then that can certainly increase someone's fall risk. So, for example, I probably wouldn't go into someone's home who had dementia and make drastic changes to the environment because they wouldn't understand how to function fully in that environment. Instead, it's usually about being much more subtle. For the same reason, you'll often see folks who have dementia or other cognitive issues, when they are at home, they're much more independent than when they're in the hospital or in a skilled nursing facility. And that has a lot to do with how familiar the environment is. So what are some fall risk factors that can often improve with treatment of the person? And certainly we can improve lots of these characteristics. Certainly strength loss from lack of use is probably the easiest to actually improve and make better. Motor coordination can often be improved with skilled intervention, with really targeted intervention. We can actually improve motor coordination. We can improve vestibular impairment. To treat those vestibular problems, you really want to work with a therapist who has specialized training in vestibular and balance issues, but it absolutely can be remediated. It absolutely can be helped. Proprioception is actually something that we can improve with treatment of the person. Some forms of sensation impairment can actually be improved depending on the cause, and some cognitive skills can be improved or decline can be slowed depending on the condition. So for example, if someone has a brain injury that they got in a car accident or from a fall, which is all too common, unfortunately, then sometimes we can actually improve their cognition through cognitive training. On the other hand, if someone has a condition that's progressing, if someone has Alzheimer's, it's progressing, we can still slow that decline through cognitive intervention. So what are some fall risk factors that are always going to require, though, strategies besides or in addition to physical treatment? You know, more often than not, it's really going to be about, for big picture comprehensive fall prevention, having these three things work together: the person, the environment, and the activities. But there are certainly situations where that's highly pronounced. So or where maybe the ability to address the person's physical or personal characteristics are not going to be, are going to be significantly limited. And so we're going to have to rely more on the environment and the activities. So those factors, those risk factors that tend to always require strategies besides physical treatment or in addition to physical treatment might be fixed or advancing cognitive decline, many forms of vision loss, permanent changes to body structure or function. So thinking about things like amputations, fixed contractures, that's when a joint gets kind of stuck and it gets stuck so hard that we really can't move it anymore. And it's unlikely that we'll be able to fix it non-surgically, or long-term paralysis. Those are all examples of permanent changes to body structure or function that require additional fall risk strategies. So also permanent loss of touch sensation requires some of those environmental or activity strategies. Loss of hearing, fixed or progressive neurological or neuromuscular disorders. Again, thinking about things like ALS, Parkinson's, MS, dementia, cerebral palsy, things like that. So what I really want you to take home here, though, is the best way to reduce falls, regardless of a person's personal characteristics, is to always address the big picture that we've been talking about throughout this whole series. And the big picture consists of the person, the environment, and the activities that they want and need to do. And we really have to see how those all fit together as a whole and make them match up in order to have a truly comprehensive, successful fall prevention program that will also increase independence and also increase quality of life. So I wanted to, before we wrap up today, I wanted to do a little case study with you all about really how that big picture all works together. So we'll be talking about an 85-year-old gentleman. He had kind of mid-stage dementia, poor safety awareness, poor visual scanning, like we talked about before, impaired proprioception. He really wasn't able to learn new things and retain that information. He was anxious, depressed. He was having some aggressive outbursts. He had a pretty much complete loss of what his normal routines were and his normal activities. And his family and caregivers were trying to prevent his falls through a use of a wheelchair. And so he was falling about 2 or 3 times a week, despite the fact that he had 24-hour care. So what I did is we did some very simple home modifications to remove the tripping hazards, bring visual attention to items that he was going to be needing to use for safety and self-care participation. Again, as I discussed earlier, for someone with dementia, you don't really want to go in and change everything up, because making the whole environment unfamiliar is probably going to make things worse. But having some small, subtle changes to just generally make it safer and bring awareness to the parts of the environment that that we want these folks to focus on. So I had them actually remove the wheelchair. This gentleman could actually walk. It was just that they weren't sure how else to stop him from falling other than trying to have him sit down all the time. So we actually removed the wheelchair and instead replaced that with appropriate support from a caregiver when walking that I trained them how to do safely. did a lot of training and retraining of his self-care activities so that he would begin to participate with those again. That's certainly possible. Implemented an exercise program for strength, proprioception, and balance. And did some adaptation for some previously valued activities, things that he had loved to do before, so that he could participate in them now. And I'll give you an example. He had previously loved to paint, just as an amateur, he liked to paint. But if you put a blank canvas and an easel or a bunch of paints, with a bunch of paintbrushes around him in the situation he was currently in, it was really too much for him to process. He wasn't cognitively able to process what he would do with kind of that sort of blank page and all of the paint. And so he actually became really anxious and overwhelmed when presented with that. But so what I did instead is I presented him instead with some, basically like pencil or black and white drawings that he could then paint inside of, with only a choice of 2 or 3 colors to use. And by just kind of reducing the number of variables and by increasing the structure of that task, he was able to participate in it again. And then, of course, the other important part of that was developing all of those things, the exercise program, his self-care activities, his valued activities, and putting them back into a daily routine that he would be able to naturally implement with the help of some caregivers, so that he could keep up with his exercise program, keep up with his activities, maintain his balance, slow down his cognitive decline, and really have a better quality of life than he was having prior to the intervention. And then, of course, a lot of caregiver training, family education, to make sure that they were able to continue with the program after I wasn't there anymore. Ooh. Okay, and so the results. So he was able to return to performing his self-care routine with supervision only. He was able to move through his daily routine with cues. He was increasingly calm, had more positive interactions with his family and his caregivers, and there was a lot of decreased stress for the families and the caregivers as well. And his falls were reduced to 0. So a really an excellent example of what can happen when you really truly look at things comprehensively for people. So let's go ahead and review and wrap up the series here. So when you address fall prevention from that big picture perspective, you have increased independence, reduced falls, reduced debility, reduced healthcare costs, decreased risk of injury and health complications. You increase that participation, increase the initiation, increase confidence of clients, patients, families, and caregivers, ultimately culminating in a higher quality of life. Again, that big picture of fall prevention is a big job, and that's why occupational therapists at AIPC Therapy are here to help you. We can help to identify risks and concerns in the environment, in the activities in the person, identify what their values and goals are and keep it centered on them, establish healthy routines and habits based on those values and goals. We can help to modify, adapt, and retrain activities, modify or adapt environments, rehabilitate personal sensory, physical, and cognitive problems that can be improved, train caregivers to help provide adequate support that actually increases safety, increases participation, and increases independence, and advocate and facilitate communication with other healthcare professionals. If we cannot do it, we will help you find the professional who can, and we will help make that process as seamless as possible. So if you need fall prevention solutions, if you need individual training, custom programs, or staff training, please don't hesitate to reach out. You've got my number, you've got my email address. I'd love to hear from you anytime. Feel free to call or text. You can request a free consultation and get recommendations for the best solutions and options for you and your situation. There are absolutely no strings attached. It's just about finding out what will work for you. On the other hand, if you're not ready yet and you just want some more free tips, please sign up for the free fall prevention newsletter. It's all about fall prevention and independence, and it's available to sign up through my website at the fall prevention page. And if you have not done so yet, please watch Fall Prevention, The Big Picture, parts 1, 2, and 3, and get a big overview of how all of this works together. Coming soon, I hope to bring you more fact-filled, practical training that can help you, your loved ones, and the people that you care for live the safest, the most independent, and the highest quality of life. Questions, concerns, or comments, please call me, Emilia, at 469-998-1245, or feel free to send me an email anytime. I'd love to talk and hear what you have to say, hear your story, and get to know what the best solution is for your fall prevention problem. Special thanks once again to Kathleen Warshawsky and Seniors Blue Book. Thank you, thank you, thank you for allowing me to provide this information to a large audience of people. I think it's vital that people have this information so that they are empowered to make good decisions for themselves and for the people they love and the people that they care for. So I appreciate so much your assistance with sharing this with as many people as who want to see it. So thank you so much. Again, if you have any questions or concerns, if you need an individual program, if you have personal concerns that you'd like to discuss, if you need staff or caregiver training, feel free to reach out to me. You can call me, text, or email, request your free consultation. There's no strings attached. Just get the recommendations that you need for the best solution and the best option for you and your situation. If you want those free tips, sign up for the Fall Prevention and Independence newsletter by visiting my website at the Fall Prevention page, and make sure that you've watched the rest of the series so you can get that big comprehensive overview of fall prevention, the big picture. And that's it for me. So thank you so much for watching. I hope you enjoyed it. I really hope that you got something important out of this that you can share with someone else. So thank you so much for watching, and I hope to see you again soon. Bye.